Do you struggle with low back pain when sleeping, walking, and sitting? Well, you're not alone. Low back pain is one of the most researched health topics online. What we're going to do today is we're going to discuss the anatomy of low back pain. We're going to discuss the causes of it and simple solutions you can do at home, such as stretches and exercises and other self-care items that can help. And then also we're going to discuss when you should see your physician. I'm not a doctor, and it's important to get serious matters checked out. Let's start with talking about the anatomy of the lumbar spine. It goes from the vertebrae L1 down to L5, and then it goes also down into your sacrum and the pelvis. So this area is responsible for stability and for movement. Anytime you need to bend down, twist, pick up things, basically anything in our daily life that involves the lower body. But here's the key. The lumbar area doesn't work in isolation. It goes down into the hip area. So if you have weak glutes or tight hip flexors, that's going to give you an anterior pelvic tilt, which when you do that, it creates more curvature in your low back and it compresses the spine and causes more pain in the area because it's compressing on the nerves. When I first consult with my clients with low back pain, by looking at their posture and how they're standing, I can usually tell what is going on throughout the body. Many times when they complain of low back pain, their hip will be shifted to the side. So as you can see, and not only shifted, but also elevated and can be rotated. So you can imagine by even just shifting to the side, what that does is it compresses the right side and it stretches out the left side, so that compression that happens on that side, it gets tight. But what happens is the disc can create a bulge that pushes out on the stretched out side. So that bulge then compresses on the nerves that can go down into the leg and other areas. Here's something else I notice in my practice. Many times my client with low back pain also have very, very little hip mobility. They feel stuck, like there's no movement, there's no rotation. So when I do tractioning down their back and I get to the hip feels like a rock. Like I say, there's no movement there, there's no rotation. And so what happens when that situation arises is the areas above your low back or above your hip into your low back and your lower spine here from your thoracic area, that is forced to work harder, and that becomes the rotation part. So you can imagine if your hip is locked in one spot, you need to have a certain spot in your spine in order to rotate. If the rotation isn't coming from your hip and that movement going back and forth like it should in a fluid motion, and this is all locked, this area and this area is going to be forced to try to rotate and do everything the hip area is supposed to do. So you can see over time, as one area is immobile and locked up, other areas start compensating for it. And that, especially in the low back, can impinge on nerves such as the sciatic nerve, which can be a very painful condition, sciatica, which creates pain and tingling down the leg as well. And you want to get the body back in balance before it gets far enough that it progresses to that much pain. So what are the causes of low back pain? We're going to go into some of the biggest factors that can affect it. The first one is the times you're sitting in a continual posture and don't get up and move around and change, especially when you're sitting. Because when you're sitting, what happens is when you're sitting down, all the hip flexors become very tight and shortened, and then your glute area gets very weak. So then you don't have, when you go to stand up, you don't have that center of gravity sitting over your low back and your hip. So that pulls everything off to the side and there's an imbalance. And so when you go to get up, you get that pelvic tilt because all these muscles are still tight. This is getting stretched out, creating an excessive curvature in your low back, impinging on those nerves. The second cause is herniated discs. We touched on that a little bit earlier, but what happens is when there is a bulge in the disc. Like I say, it can squeeze out and impinge on the nerves around it, which causes pain and sometimes numbness or tingling in other areas such as down into the legs and the hip. Another is degeneration over time. It can either be a degeneration in the joints in your discs. Maybe there's a genetic component there that can make you more susceptible for it. There could be nutritional deficiencies that aren't getting met in your joints, such as using collagen type 2 that is really good for joints and connective tissue. And then also there can be bone spurs that form on the actual vertebrae and the vertebral bones that can come down and impinge on the important nerves as well and can be very painful. Another is one-sided pain in the low back. It could be low back pain on the right or low back pain on the left side. And this points back to what I was speaking about earlier about there being an imbalance in the low back, such as the shifting of the hip to one side. Maybe even if they're in the center, a hip is elevated. Maybe because when you sit in a chair, you tend to lean to one side in the chair, or when you're in the car, maybe you lean on the armrest of the car when you're driving for a long time. So anytime we take that posture and we put it off to the side, that will impinge on different areas of the low back because that's where the twisting and the bending is coming from. So all of these factors often interact. For instance, if you're shifted off to the side, there's an imbalance on one side, pain on one side. It could be coming from herniation. There could be bone spurs. So there's a definite cause and effect. Pain is a symptom, and it's your body's way of saying, hey, there's an imbalance here. Something isn't right. So you want to make sure to get to the source, and that's what I do in my practice. I get to the source of what's going on, such as the imbalances. The good news is movement is one of the best things you can do to start feeling better. Now I'm going to list some exercises and some stretches that may help with the pain. The first one is the glute bridge. What the glute bridge does is it provides more stability for your back, your hip, and it strengthens your core too. So that way you have that consistent strength throughout your body so you don't have as much pressure coming from that area. The next one is the cat-cow or pelvic tilt. What this does is it mobilizes the lumbar area without putting a lot of force on it. Another is the child's pose stretch. What this does is it helps relieve tension in the area. Another excellent exercise to do for low back pain is go for even in just a short walk. Make sure you're getting up from your job throughout the day and just get out there, and even if it's just a walk around the building, because you want to keep the lymph and the fluid moving so that way your joints stay lubricated, and it's very important to keep that fluid going. And another suggestion that I tell my clients is if you have some electrolyte water, so if yes, it has potassium, magnesium, and calcium, all three of those minerals are very important for nerve transmission, for pain management, for dehydration. If you're dehydrated, everything's going to get sticky and a lot more sore. So by drinking that, quite a bit of that before you get up and go for a walk, you can start getting that in your system. So that way when you're walking and your joints are moving back and forth, that fluid is getting pumped into that connective tissue and into the joints of the low back and other areas. So that will decrease leg spasms, decrease spasm actually throughout the body, and increase hydration. So the pain should go down when all these things are taken into consideration. And as I mentioned earlier, the low back is just one piece of the puzzle. Usually it's as a result of a compensatory pattern that's going on throughout the body, including the upper back and the hips and the neck area as well. So everything is connected. I can throw everything off. And a couple things you can do, some good stretches that I have shown in my knee pain video, and then also in my shoulder pain video, are stretches that open everything up. Because if you're sitting or you have a profession where everything is compressing you, or you're looking at your phone a lot, your whole body is getting pulled down and forward. So the stretches in my videos that I will show at the end of this video and leave in the description, like I say, it's my shoulder pain video and my knee pain video, have those stretches to open up the entire front of the body. So when you do that, everything is centered over your hip. And when everything's centered over your hip, then your body doesn't have to work quite so hard. Everything becomes more natural. You can stand up straight naturally. You don't have to try to force yourself to stand up straight. You may have heard that from your mom. Put your shoulders back. Sometimes it's not that easy to do. And when we become caught in these patterns and sitting like that for so many hours, your body develops that pattern. The connective tissue gets sticky. It pulls you forward. So trying to force yourself to stand up straight or getting a back brace to pull your shoulders back, that helps with the symptoms, but that doesn't solve the problem. It doesn't solve the source of the problem. So you need to strengthen everything on the backside and open everything up on the front side, and then you'll be able to stand a lot straighter. So like I say, you want to remember everything is connected and the body compensates for imbalances. So instead of walking around like this, say you're leaning in your chair all day, so all this gets shortened. So you're not walking around like this, your head starts doing this because the body craves balance in a center. So it compensates for doing that. So that way your head's not like this, your head goes like this, and then pretty soon, here comes pain. Usually it's on the stretched out side. Usually a pain on the opposite side of the body. So a lot of times what I see in my practice is you could have like pain in the right hip, but because of the compensation going on in the upper body, you get pain in the left side of your neck eventually. So we want to remember to look at the body as a whole and center it as much as possible. And what you can do is stand in front of the mirror and just soften your gaze. Start looking at the level of your shoulders and look at the level of your hips. Notice on your hips or your shoulders, you can usually see, if it's really bad, you can usually see one shoulder that's down farther. And usually if one shoulder is down farther, then the low back hurts because it's going like this. So everything is scrunched on this side. So by softening, really tuning into your body and softening and feeling subconsciously that shifting going on or that rotation, sometimes you can even see the rotation in your hips. If you're standing in front of the mirror just in your underwear, you can see where your hip bones are. You can see the top of your hip area and see how everything lines up. And many times you might be surprised and physically see, hey, there's a lot of imbalance going on here. And you can start seeing that compensatory pattern that your body's trying to do so that way you stay centered in gravity and stay lined up. In addition to exercises and different stretches, I'm going to discuss now 6 different self-care things you can do at home to help with your low back pain. The first one is applying heat or ice. It depends on the inflammation that's going on in the body and if it's just tense. If there's heat there already, the body is inflamed in that area, and you generally want to use a cold pack and lay that on there for a little bit. You don't want it super, super cold. That's why I like using the soft cold packs, because then it can mold around the low back and the sacral area. And so what that will do, it will take a lot of the heat out and the inflammation in the area. But if it's just tense and you just need to relax it, what you can do too is use some type of heat pack on it. Maybe stick something in the microwave. Sometimes there's different heat packs you can stick in the microwave for a short period of time, and then you lay on it, and that can help release a lot of the tension. Something that has helped me a lot with my low back pain, and I recommend a lot to my clients, is a red light therapy belt. Not sure if you might have seen those on Amazon. Unfortunately, the one I like and that I use isn't available. But what you can do is just do a search for red light therapy belt. And you want to find one that has different intensity levels, because you want something that penetrates really deep. The red light therapy brings down the inflammation and it brings circulation to the area. It brings so much circulation to the area that I find that after I use it, the area will itch like crazy and my pain goes way down very quickly. And I'll lay on it, maybe watching a movie or just something to relax at the end of the day. Maybe you like to read, you can do that for a while. One client that I have worked on, she traveled a lot for her job. So she was on the road in her car a lot. And so she would get a lot of the back pain that she experienced while she was driving because she was in that position for so long. And she did research and she found a red light therapy belt that she could actually use in her car. So this, by using this in her car on her long trips, her low back pain significantly went down and helped out a lot. Another important self-care strategy is to pay attention to how you sleep. The best position to me for sleeping for someone with low back pain is on their back with a pillow underneath their legs. So by elevating your knees, it shifts your pelvis to help take the pressure off of the low back. So that works great for low back pain. But I find in my practice that a lot of my low back pain clients tend to be side sleepers. Now, unless you barricade yourself in so you can't move while you sleep, you have no idea what position you're in when you're asleep. So what I recommend with them is to have a pillow, if you're laying on your side, a pillow between your legs, pillow between your arms. You may have heard this very common suggestion. But in addition to that, what I would also do that has helped me when I wasn't able to sleep on my back is to put another support, like another pillow, or sometimes you can find lumbar support pillows online and be able to put those underneath. So when you're laying on your side and you have the pillow here and here, what it does is if you don't have that support, say this is the side of the mattress, if you don't have that support, your spine is going to dip down because there's nothing underneath it to keep it up and level with the rest of the spine. So you have your hip and then your low back curves towards the mattress because there's nothing there to support it. So same principle as the pillow between the legs and the arms, you want a pillow underneath your low back if you're laying on your side to help with that curved dip that the lower back does in order to, just gravity pulls it towards the mattress. So by having that pillow in there, it will bring it back up in alignment with the spine, and it should decrease some of the pain when you're laying on your side. And along the same lines as paying attention to your sleep, you want to make sure you have the right mattress. There are so many different styles of mattresses out there, but the biggest thing is you want to have it firm enough that it provides support for your back, so that way it doesn't create a hammock effect. A lot of older mattresses especially, you can start developing spinal pain problems because over time it creates a hammock effect, so your body curves down into it instead of being supported and staying out nice and firm and flat. And then you want it firm enough to support, but then you also want it soft enough that it still allows the circulation to flow around your different bony regions, and fluid and blood flow can get to those areas. And then also you want it soft enough that it doesn't press on different trigger points in the area. I'm sure you may have slept on a mattress that was too firm and you go to get up and you just were super sore and achy. That was the problem. If it's too firm, it's going to press on all those trigger points and cause that extra pain. Another area to be concerned with for self-care is how we sit. We spoke earlier about how sitting for long periods of time can affect the tension throughout the front and the back of the hips and the whole body, actually. But what many people don't realize is many times our chairs can be unlevel, or even the floor can be unlevel that our chair sits on. So if you take an actual level and you place it on the floor first and see where the bubble hits and see if it's in the center or not, and then check your chair also. And especially chairs that I've noticed, office chairs that rotate, depending on the rotation side of the chair, I noticed the level can actually change. So over time, if you have even just a fraction, a small difference, and you're sitting for many, many hours a day in that position, your body's going to set up a pattern. So if, say, this side of the chair is higher, so your body even slightly is coming up higher, and it's also shifting. So it's setting up all these patterns and imbalances, eventually creating pain in that low back. And lastly, as we've touched on for self-care, you want to get up and make sure to move around, or if you're up moving around, you want to change positions as much as you can. Because like I say, the body needs movement. It's not meant to stay in one position for long periods of time, and it craves that fluidity throughout the body. And the lymph system needs movement to create that pump. You may have noticed when you sit for long periods of time, maybe you'll get a lot of fluid in your lower legs, especially if you drink coffee, drink soda. I notice if I drink soda, I'll have a lot more swelling in my lower legs because of the mineral imbalance and everything that happens with all of that. So by getting up, moving around, standing for a little bit, you can actually help decrease or eliminate some of that lymph that gets trapped in the lower part of the body. There are times you need to for sure check with your physician, because if you have severe pain or numbness or tingling that goes down into the legs, that can be very serious. If the herniation's extreme, where it's pushing on the sciatic nerve, you may have to check with your physician to see if there's other thing, possibly surgery that can be done if it's extreme. You might have bladder or bowel function problems. Any of those type of situations, you always want to check with your physician. I'm not a doctor. And the information in this video is for educational and informational purposes only, that can help you with self-care things that you can do on your own. But please seek out the care of a medical physician if any of those other situations are extreme. So to recap, we want to make sure not to look at the low back in isolation just within itself, because it's part of the bigger puzzle. Different areas of the body, because it compensates so much, different things can come from your legs, from your hips, your upper body, even down in your feet and your arms and your hands, depending on how the body is trying to correct itself from that imbalance. And so the pain is actually a symptom in the body's way of saying, hey, there's an imbalance here. We need to look at the source. Just because an area may hurt, it doesn't necessarily always mean that's where it originates from. If you have found this video helpful, please let me know in the comments. I would love to hear your experience, and feel free to share it with someone else, maybe friends or family that you know that also has low back pain. Like I say, it's a very common problem for many, many people. And by sharing this information, we can help them feel better as well. Also, like and subscribe, and stay tuned for more self-care tips.